Hello, my name is Beth and I'm a nurse. I am going to talk to you about cervical screening. Cervical screening is an important test, so please come for it when you have been invited. Cervical screening is a test for people with a cervix. It's also called a smear test. I have an image here to explain where it is on the body. The cervix is inside the body, so you cannot see it. Having the test can stop you getting cervical cancer and saves thousands of lives every year. This is why it is important to have one. Of course, it is your choice whether you do or do not have the test, but we do recommend it. If it is your first time, I have a little bit of information about how often you need to have one. We will ask you to come for a test every 5 years when you are between the age of 25 and 64. You will get a letter through the post when it is your turn for the test, inviting you to book an appointment at your GP practice. You need to make sure you are registered with a GP, so you are invited for one. The reason we carry out the cervical screening is to test for HPV. HPV stands for human papilloma virus. It sounds like a lot of jargon, doesn't it? Well, HPV is simply an infection that is passed on from skin to skin contact. This is when you have skin-to-skin contact of the genital area with someone. Even if you're not sexually active, it's important to still have screening. Most people may get the virus at some point in their lives, but if you do, your body will fight the infection and will usually get rid of it. However, sometimes it does not go away. If this happens, it can lead to cervical cancer. When we give you a test, we can see if you have HPV and any changes in the cervix. If you do need treatment, this can stop cancer ever happening. Everyone with a cervix and at the age of screening will be invited for the test, even if you aren't having sexual contact with anyone. Most people will have a negative result. This means your risk of getting cervical cancer is very low. If you have a positive result, this means the virus has been found. If this is a result, you will be invited for another screening or for a closer look at your cervix. It is your choice to have the test, but we recommend that you do, so we can make sure that you stay healthy. You can bring someone with you for support, and we can make sure you have a longer appointment. You can ask any questions you have, and we can spend some time going through what happens in the test. I look forward to seeing you soon for your screening.